Great to see the thumbs up and everyone letting me know that you've joined. Good morning. Oh, that's so lovely seeing everyone's good morning wishes in the chat. Just give it one more minute and then we'll start. Stacey, I can see you've got your hand up. You might want to put comments or anything in the chat. It might. Or I think everyone's trying to give the thumbs up and is accidentally pressing the raise hand function. Okay, well, we might make a start. Good morning, everyone, and welcome to the 14th Advocates and Allies webinar. Thank you all for joining us today. We have had an incredible response to this webinar topic with nearly 500 registrations. And for those of you who I haven't had the pleasure of meeting, my name is Evelini Tadros, and I'm the CEO of the Mental Health Coordinating Council. Advocates and Allies is a webinar series designed to strengthen the capacity of community mental health workers and equipping them with advocacy skills to support people navigating a complex service system. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today all over the country. I'm on the land of the Cabrogal clan of the Darug Nation, and I also acknowledge that this land was accessed by people of the Dharawal Nation. And I pay my respects to their elders, both past, present and future, for they hold the memories, the culture and dreams of the Aboriginal and Torres Strait Islander people. I recognise and respect their continued relationship and connections to land, water and culture. And I take this moment to acknowledge that last month, MHCC submitted the first draft of our Innovate Reconciliation Action Plan to Reconciliation Australia. We've received our feedback and we're working with our MHCC's First Nations Working Group to refine and implement. I also want to begin by recognising those with lived and living experience in mental health challenges. Your insight and expertise are integral to shaping our work and we deeply value your contributions. I also hold the space for those who remain silent and private about their mental health struggles, recognising the courage it takes to share or to quietly navigate these experiences. I just wanted to alert participants that today we're dealing with some difficult topic areas and sensitive topic areas, and the discussions that will take place may be distressing for some. I urge you to do whatever is necessary to take care of yourself, and there is a list of contacts that the team will put in the chat shortly should you need to access them. As to the topic at hand, coercive control is increasingly being recognised as a serious form of harm that can have profound impacts on a person's mental health and well-being. Unlike isolated incidents of abuse, coercive control often involves patterns of behaviour that create an environment of ongoing fear, domination, and loss of autonomy. Over time, this can lead to chronic stress, trauma, social isolation, and significant violations of a person's rights. For the community mental health sector, understanding coercive control is critical. Many people accessing community-based mental health supports may be experiencing or recovering from these forms of harm, and services play an important role in recognising the signs, responding appropriately and supporting recovery, and sometimes even just identifying that this is what that person has experienced. At MHCC, building workforce capability in trauma-informed and rights-based approaches is a key part of our work. Addressing coercive control requires these approaches to be embedded not only in individual services, but across the broader mental health and human services system. This makes today's discussion particularly timely and important, and we're very fortunate to be joined by three presenters who bring deep expertise and diverse perspectives from their respective fields. I'm delighted to welcome Angie Gill, Safer Pathways Senior Policy and Advocacy Officer at Domestic Violence New South Wales, Anna Gauci, Communications and Engagement Manager at the New South Wales Ageing and Disability Commission, and Maria Casaniti, Centre Manager at Transcultural Mental Health Centre. Our speakers bring a range of expertise and experience and will help us to explore coercive control and its impact on mental health. A reminder, if you do have any questions throughout the presentations, please drop them in the Q&A box, preferably not in the chat. You'll see at the bottom along the line, you can click on more and you'll have a Q&A box and you can place all your Q&A questions there. We'll try to get as many as possible, try to answer as many questions as possible during the dedicated panel discussion at the end. So you can put your questions through as a panelists speak, but we won't answer them till the panel discussion. It is with great pleasure now that I welcome our first presenter, Angie Gill, Safer Pathways Senior Policy and Advocacy Officer at Domestic Violence New South Wales. Angie has worked in domestic, family and sexual violence interventions for over 25 years, with a particular focus on practice and advocacy for systemic change within the justice system. Angie is committed to the continuous development and support of greater access for victim survivors of domestic, family and sexual violence to justice and healing systems. Over to you, Angie.
Thanks so much, Evelyn, and it's great to be here. Before I start my presentation, I'd also like to acknowledge that I'm currently on the lands of the Gadigal people here in Redfern. It's a beautiful day outside here in Sydney. So welcome, and I'd like to pay my respects to elders past, present and emerging. And yeah, like I said, it always has been, always will be Aboriginal land, and it's just beautiful to be on these lands today. Now I'm going to share my screen. And of course, it's not going to work when I need it to.
That's all right. I'll let you know when it's working.
It's not up yet.
Not yet.
Okay.
So you're pressing the share arrow at the bottom.
Yeah.
And then selecting the screen that the presentation is showing on.
And my screen just isn't here. Just let me see if I can. Sorry, we did do a run through. Here it is. Got it. Beautiful. Okay, you can see that now?
Yep, just put it in presentation mode and then you're good to go.
It's a bit laggy. I do apologise.
Well done.
Okay. So like Evelyn said, my name is Angie Gill and I am a Senior Policy and Advocacy Officer with Domestic Violence New South Wales. This is our team. And effectively, DV New South Wales is the peak body that represents specialist domestic and family violence services across New South Wales. So we raise the issues that are on the ground around domestic and family violence, and we elevate the voices of those with lived experience and those experiencing domestic and family violence, and we strive for policy and systemic reform. So I'm going to dive straight into it, just with regards to coercive control. So in New South Wales, coercive control became an offence in New South Wales on the 1st of July 2024. And by definition, coercive control is a pattern of behaviour that aims to control or dominate someone, and it's often very strategic and calculated. So there is an intent behind those behaviours. In the context of domestic and family violence, this can include physical or sexual violence, emotional abuse, stalking, isolation from others, controlling money, using technology to harm, reproductive control, or misusing systems against someone. And so, for example, abusers may use tactics involving threats to hurt or kill their victims, their children, their pets, and isolating them from family, friends, and support services, including cultural and religious practices. The New South Wales Domestic Violence Death Review team have found that coercive control tactics were evident in 97.6% of domestic and family violence homicides between 2000 and 2022. Most of those instances weren't reported to police. So this is a very, very underhanded pattern of abuse that is used against victim survivors, something that we need to be aware of. I also want to talk at the front end of my discussion also about the fact that I will be using gendered language, which means that the statistics in this country and internationally suggest that men are more likely to be the abusers of domestic and family violence, and women are more likely to be the victims. So I will be using gendered language as an example going forward. Okay, so coercive control and mental health. Perpetrators may deliberately exploit someone's mental health concerns to increase control, undermine credibility, or isolate them further. Some common tactics that we see is gaslighting. So telling the person, for example, that they're imagining things that are actually taking place and actually occurring, or even telling the person that they're imagining that they're feeling a particular thing, a particular emotion when it comes to the behaviour that's been perpetrated against them. They also may inform the person and others around them that they're too unstable to remember the incident or the behaviour properly. So that's something to be mindful of. The gaslighting also includes the rewriting of events and blaming the confusion for that on the mental health diagnoses. So they will use somebody's mental health to continue to inform them that the situation isn't how they saw it, how the victim survivor saw it. And they will suggest symptoms are proof they can't trust their own perceptions. Pathologizing normal reactions. So, what we see is that the person who's using violence will frame the trauma responses like fear, hypervigilance, or distress as evidence that the person is crazy or overreacting. So really pathologizing very normative responses to an incident or event. And using a diagnosis, either real or fabricated, to discredit the person with friends, family, police, courts. We see this quite regularly. So the person, the victim survivor, will have a diagnosis, and the person who's using violence will constantly use that within the systems that they're in, quite often with regards to family law and criminal law proceedings. Threatening institutionalization, so threatening to have the person involuntarily admitted, and we all know how incredibly traumatic that process can be. Using mental health legislation as a scare tactic, telling children or others the person is too unwell to parent safely. So really weaponizing any kind of diagnoses or historical mental health in terms of parenting capacity. And in that space too, we do see a lot of recruitment of service providers in various areas. So mental health providers, general practitioners, quite a lot of health areas of specialty who don't necessarily understand the dynamics of domestic and family violence. Quite often, people who are using the violence can recruit those service structures into that weaponization. Interfering with treatment, so withholding or sabotaging medication, preventing attendance at therapy or medical appointments, or demanding to be present with the victim survivor at any appointments that are scheduled, monitoring or controlling communication with mental health professionals, sometimes talking on behalf of or scheduling those appointments. So the person who is using violence can always be on top of the conversations that are being had with mental health professionals. Isolation, so telling others that the person is unstable to reduce their support network is actually really quite common. So there'll be a narrative that is developed over time for people that the victim survivor may rely on for support, whether it be informal or formal interventions. This can also include cultural and religious isolation, so withholding cultural items, time with cultural solidarity, or basically anything that the victim survivor relies on around their religious well-being or cultural well-being. Encouraging withdrawal by reinforcing shame about the victim survivor's symptoms, and positioning themselves as the only one who understands. So quite often the person who is using violence will create that narrative and that total dependence for the victim survivor, and will provide that narrative quite constantly, that they are the only person in their world that will ever be able to understand the issues that they're facing. There's financial abuse linked to mental health, claiming the person is too unwell to manage money, taking control of finances for their own good, undermining employment by exacerbating stress or triggering crises. So we see in the workplace quite often that the person who's using violence and is trying to maintain that absolute control will actually sabotage that employment by constantly calling, constantly turning up to the workplace, creating a false narrative about the victim survivor. So the workplace is unable to maintain that level of coercion and those constant disruptions. And so the victim survivor will quite often either lose their job or have something put in place that actually can sometimes place them at greater risk. Weaponizing disclosure, so using private disclosures about trauma, about the victim survivor's trauma, their diagnoses or suicidality to manipulate, threaten, or humiliate. Threatening to expose mental health history in custody or legal disputes. Like I said before, that's actually a very common weaponization. And coercive control through crises, intentionally escalating abuse to trigger distress, then pointing to the reaction as proof of instability. So it's building that narrative of the victim survivor effectively being crazy, provoking something, an incident, and then when the victim survivor reacts to that incident or that behavior, it reinforces what the perpetrator or what the person who's using violence has initially framed. Also, calling police during heightened emotional responses to frame the victim survivor as the aggressor is actually incredibly common. It's a little bit, it's more common than we actually think. So when the victim survivor is quite elevated and is showing resistance to the violence or the threats of violence, that is when the police will be called, and the police will actually see the victim survivor in that state. And so quite often we're seeing victim survivors are being charged with domestic and family violence related offences, such as destroy or damage property. There's an AVO placed against them because the policing system in New South Wales is very incident-based, effectively. So that's a real tactic, and that further controls the victim survivor. Okay. So impacts on mental health, which I'm sure you all know. So coercive control slowly erodes a person's personal freedom. So when someone is repeatedly told what to do, who they can interact with, how to spend their money, and how they must behave, then they're threatened if they don't comply. This often leads to people fearing the consequences of stepping out of line and gradually lose their sense of autonomy, self-worth, and ability to leave the relationship. So they become entrapped. It's a sense of entrapment, and it's actually it eliminates, it actually erodes the individuals, the victim survivors' autonomy on all levels. What we might see is some common side effects on the impacts of mental health within the context of coercive control. It can lead to substantial emotional, psychological, and even physical concerns. So in the context of mental health, it can look like sleep disturbances. Quite often, victim survivors will be planning the next day, the next few hours. They are always trying to think just that little step ahead to be able to ensure some level of safety. So quite often, sometimes that will happen, and the hypervigilance and their nervous system just won't allow them to come down. So sleep disturbances is really quite common. Anxiety and panic attacks, that feeling of being emotionally numb. So the person will actually stop having any affect at all because they're constantly in their mind waiting for the next thing. Identity disturbances, which is really quite common, effectively because the person who's using violence is effectively telling the person who it is that they are. So quite often victim survivors will have a very, very affected sense of identity. Self-esteem issues and confidence issues, being able to even pick whether or not I can have a tea or a coffee today, because that choice effectively has not been presented to me as the victim survivor. So it's really difficult for victim survivors to step out on their own and have a sense of any sense of self-esteem, positive self-esteem. Depression, difficulty concentrating and making decisions. As I just said, the decision-making process has been, effectively it's been severed for quite some time in significant cases. And feeling disconnected from everything, from people, from the environment, from culture, from religion, from everything. Just conscious of time. Okay, so what to look out for in a relationships if you are working with people, and what are just some of the things to look out for with regards to coercive control. So if the person who's using violence is checking or reading someone's messages, emails, or other communications without the victim survivor's permission. Quite often, the people who are using violence and coercive control will actually know exactly where the victim survivor is or what they're up to or who they've been speaking to, because they're actually reading everything, either before the victim survivor or with the victim survivor. Controlling finances by closely tracking spending or insisting on handling all money matters. And quite often what we see is issuing an allowance, so providing the victim survivor with an allowance, and if there is anything to be spent outside of that, and even in that, everything is tracked. So any item that's purchased, there will be a tracking of those receipts, for example. So that way the person who's using violence can have full knowledge and full tracking of every single cent that's spent. Making insulting or belittling comments, even if presented as jokes or constructive criticism. In public, quite often they'll come out as being a joke, being a bit of a laugh. So other people will find that quite amusing and endearing. But in reality, it's a form of belittling and keeping the victim survivor exactly where they want them to be. Limiting or discouraging contact with family and friends, sometimes framed as concern for their well-being. So really limiting that as in it's not going to be good for you to see your family again. Remember last time you went to see your family and you came back and you're really upset? I just don't think it's good that we see them. And bit by bit, that contact with family and supports are diminished. Threatening to end the relationship, engage in sexual activity with someone else, or emotionally punish the person for not complying. So effectively saying, you will do this, or I'm going to go and find somebody else. I'm going to leave you. And for a victim survivor who's in that space of being so effectively coerced, or where the perpetrator has effectively coerced the victim survivor, that can be like such a desperate and debilitating space to be. Frequently threatening to hurt oneself or others if the partner tries to leave. We see that quite regularly. So threats of suicide if the person is to leave, threats of harming the animals, threats of harming children, or somebody that they think that the victim survivor has a relationship with. Demanding access to passwords or tracking the partner's phone or location. Controlling daily routines, including choices about clothing, meals, or schedules. Undermining self-confidence by constantly questioning decisions or abilities. So as a bystander, these are some of the things that you can be looking out for. So this is what it kind of looks like and feels like. So she seems afraid of her partner, or is always very anxious to please him. And so you'll be able to pick up some of those dynamics if she's either really quite scared of him, or just so intently listening to everything she says, so then she can respond in a way that's actually going to make him happy, and eliminate anything that's going to potentially happen from that conversation. She often cancels plans at the last minute. So plans are all set. You might be talking about the plans that you're going to be, catching up for dinner on the Friday night. and it'll be about half an hour before that she will have to cancel. And what has probably taken place is hours prior to that of her being effectively told that she can't go in various different ways. She seems afraid something may make her partner angry. So if he's angry, he's likely to take it out on her. So constantly just being really hyper vigilant about what it is that's being said, whether it be by the victim survivor or other people. She's constantly looking out for those little pieces that she can then she will effectively know whether or not those little pieces of information has made him angry or not. She stops seeing friends or family, stops her phone calls when her partner comes into the room. So if you're on the other end of the phone will just stop. And in those situations, it's actually best not to call her back if you know that these are the issues that are going on. So even as a service provider, calling her back straight away would probably potentially put her in further danger. So safety planning is so incredibly critical when there's been any kind of disclosure or if there's assumptions around coercive control. Her partner continually phones or texts her when she's out of the house. So if you're out for dinner, if you made it out on that Friday night and you're out for dinner, there'll be constant texts and there'll be constant phone calls. Quite often she'll leave the table to have some of those phone calls, and her phone will generally be near her, so she knows that if something comes through, she'll need to respond very, very quickly. Her partner is jealous and possessive and accuses her of seeing other men. This is very, very common. So the constant accusations of infidelity. The partner can also be jealous of children, particularly if the children are not his. So that's something to also be very aware of, because sometimes they will, the perpetrator will actually try and sever the relationship between mum and children at times. Her partner seems overly attentive, remains constantly by her side, or is watchful about who she talks to. So whilst that may look like a caring kind of support model in a relationship, sometimes that can be incredibly controlling. So it might really be about support. It's more about maintaining the control of the person and understanding exactly who they're talking to and what they're talking about. She has become anxious or depressed, quieter, and may have lost her confidence. Sometimes it's, important to lean into those conversations about your observations around noticing that she's just been really quiet lately. Is everything kind of okay? It's okay to be curious in those circumstances. Her or her children's behaviour has changed and she appears frightened or exhausted. With coercive control, women will be absolutely exhausted because they cannot stop. They've got to ensure their safety by constantly being 3 steps ahead, and that is how she maintains the safest outcome at the end of the day. So quite often, if you are talking to a woman who is experiencing this, she will be absolutely depleted of any energy. And providing support. So effectively, before the conversation, make sure you can stay and listen if they open up to you. This isn't a passing conversation. This is an important discussion on safety. It's also important to make sure you're in a place she feels safe. So effectively, if a conversation is going to open, it's really important that you stay with that. Any disclosure that a victim survivor will make, that first disclosure particularly, the responses that you provide will determine, or it will have such a huge impact on the trajectory of what happens next. So it's really, really critical that you're leaning into these conversations with curiosity and non-judgment. Victim survivors will pick up any form of judgment in a nanosecond. So if you're leaning in with judgment, it's very, very likely that the victim survivor will disengage, which is effectively quite dangerous. So it's just very important to keep ourselves in check around how we're leaning into these conversations. It's important for victim survivors to obviously know that it's not their fault, but in a non-patronising sort of way. We know that people who are using violence are choosing to do so. But it's very, very important that we provide those messages to victim survivors at their pace. If we come in really, really too hard at the very beginning, again, we could lose engagement with that victim survivor. So it's very, very important to be respectful of where they're at and manage that pace. I would also always encourage you to reach out to specialist services for advice and work together. We do work in a very, very siloed service structure. We all have, our areas of expertise, and we go a lot and manage those areas. But when we're talking about domestic and family violence, and particularly coercive control, it really does take a collaborative approach. It really it involves, cross-sectoral support and time. Sometimes the unpacking even some of these issues with a victim survivor can actually take quite a lengthy period of time. And as long as her immediate safety, that she is safe in that moment, that's the reality. We can't rush these processes. It takes victim survivors, I think the average now is up to about 12 times to leave. And there are a myriad of reasons around that. So it's just important to be able to really sit and hold where the victim survivor is at. And I think I've probably run a bit over time, so I do apologise. So I will stop sharing.
Thank you so much, Angie. There's a lot covered there, and it really sets the context for the remainder of the discussion. So thanks for taking the time to present and join us. It is now my delight to introduce Anna Gauci, who is the Communications and Engagement Manager at New South Wales Ageing and Disability Commission. Anna is manager of the Ageing and Disability Commission's Communication and Engagement team, working with stakeholders and communities to build awareness and capability to prevent and respond to abuse of older people and adults with disability. Prior to joining the Commission, Anna held leadership roles in policy and engagement at the New South Wales Public Guardian. Thanks for joining us, Anna.
Thank you so much, Evelyn, and thank you so much to the Mental Health Coordinating Council as well for having ADC here today. I'd like to acknowledge that today I'm sitting on the lands of the Parramatta people, and it sounds like everyone else is in a very sunny location, and I'm really happy to be here and acknowledge any Aboriginal and Torres Strait Islander people who are joining us today as well. So I'm going to talk a bit about the Ageing and Disability Commission and what we do and who we are. And I also want to thank Angie for the broad and really important insights that she gave into what coercive control is and how it permeates. So there will be a little bit of double up, but really for the Ageing and Disability Commission, our focus is on older people and adults with disability. I know there's lots of different commissions around. So our commission is a New South Wales independent government agency, and we're pretty young. If you've not heard about us, we started in July 2019, so heading up to turning 7 this year. And our primary role is that we respond to reports about abuse, neglect, and exploitation of older people and adults with disability when that's occurring in their family, home, and community. So we're not looking specifically at paid workers. It's generally a family member or a friend or a carer or someone in that trusted role. They're the reports or the alleged perpetrators that we're responding to. So we respond to matters of abuse where no other agency or appropriate body can respond. And our legislation, being young, is very much person-centred. So it in the principles, it's very much will and preference based about the person, and everything we do really focuses on the person as well. In our role and under our legislation, we also have the role to raise community awareness. So these kind of opportunities are really important for us. And we also have a role to advise government and report on systemic issues that are affecting older people and adults with disability. So if you've ever worked in child protection, you're probably familiar with mandatory reporting. We are not a mandatory reporter. It's not mandatory to report to the Ageing Disability Commission. I'm just going to refer to us as the ADC. And anyone who has reasonable grounds to believe that the adult is subject to or at risk of or experiencing abuse can make a report to us. So just to clarify, when I say adults, that's people who are 18 years and older who have a disability, and the definition of disability is extremely broad. It connects to the Disability Inclusion Act. We're not asking for proof of disability when people contact us. For older people, that's people who are 65 years and older, or 50 years and older for First Nations people. And again, those people may also have a disability as well. So under our legislation, people who make reports to us can have protections. So for instance, under our legislation, if a reporter makes, if they're making that report in good faith, that aligns with our legislation, then they're not liable to any civil or criminal action or disciplinary action, for instance, being reprimanded by their employer. Also in our legislation, reporters rather, can be have their identity protected. So you can make a confidential report to us. The only time we can't maintain that confidentiality is if it went to like a criminal investigation or something like that. And that's really important. Say, for instance, if you're the only safe person in that adult's life, and they've trust you and they've made that disclosure to you, we recognise that importance, and as much as possible, we'll maintain that confidentiality. So we have a helpline, that Ageing and Disability Abuse helpline, and everything comes through that helpline. And there's lots of different things that can be reported to us. Here's just a list of some of the different kinds of abuse. But unfortunately, and most commonly, it's rarely just one type of abuse that we see in a report. Usually it's a combination. And as Angie so well explained, coercive control just runs through many of those reports. Look, this is just a little bit of data. I'm not going to go through this, but just to say that this pattern has not really changed since the ADC started in 2019. That breakdown between adults with disability and older people, that's about the calls that come to our helpline. When matters go to an investigation, that balances out a bit more. But a couple of things I do want to point out is that the main reporters to us, both for older people and adults with disability, are paid workers, and that's followed by relatives, so family members, adult children, intimate partners. And so that's why this opportunity is really critical for us. You might be a frontline worker, you might be working policy, you might be in a leadership role, you might be working in community and supporting your community, or you might be a carer yourself. So we really value these opportunities. You have very trusted roles and really like that line of sight and critical roles of also letting people know about what their rights are, and what this is, and the kind of things that they can do as well, or to contact our helpline as well if you feel that it's at a point where you need to make a report. The other thing I just wanted to point out is that for the ADC, what we see in the reports that are made to us are that people are in situations where they should be feeling safe and protected and supported and cared for, but often that's where this abuse is occurring by someone in that trusted role. And from the outside, that might seem, like nothing is happening, but for that person, there's definitely quite significant issues happening. And again, there might be multiple issues that they're also facing. They probably rely on that person to be their communicator, or to take them to get medical help or medical supports or whatever it is that they need, which can really kind of add those layers on as well. And just to also again echo Angie, women feature most commonly in our reports too. So just a little bit about if you contact the ADC, what you can expect. So as I said, everything comes through our helpline. That's the public-facing entry point, and it's not a traditional intake line. So the team will provide information and advice. They can provide referrals. Sometimes it's just a one-off contact, but sometimes it can involve up to 3 months follow-up. So especially where we're supporting people to improve their own or another person's safety, to connect them with services that can assist, or to gather information to understand what safeguarding does this person need, and who is best placed to help. So a lot of that is really about upskilling the reporter, be that a frontline worker, family, community, or the person themselves. Now, when our helpline identifies that there's no other agency to respond and the person's still at risk, the matter's escalated to our community supports and investigations team. And under our legislation, we have powers that enable us to make preliminary inquiries. And so by doing that, we're able to do a lot more assessment of the risk and also to clarify what our role is, and also to ensure that the person receives the most appropriate support. Sometimes that can involve us requesting records and information to really help us get a full picture of what's happening in that person's life. And that's another authority that we have under our legislation. Our teams do conduct home visits, and that's to establish trust with a person and to assess their safety, and also to understand what their will and preference and what they want and what's important to them. But the focus is always on the least intrusive intervention first, and we're aiming to connect people to supports where possible. It's also not a punitive approach. So if we see that the issue is actually that the carer is under an extraordinary amount of stress and is not accessing supports that probably would help them, then that will be the approach that we take about connecting them to the right services. Now, we also can undertake investigations where there's a significant risk to the adult. And to undertake an investigation, we need to have the consent of the adult. There are times where we can start an investigation without that person's consent. Has to meet certain thresholds. So, for instance, the person isn't capable of giving an informed consent despite us working with them to provide appropriate support to make that decision. Also, if we deem that the seriousness of the allegation or the risk to the person warrants an investigation, then we can commence that. Or if we made reasonable efforts to access the adult, and for instance, we've been blocked by the alleged perpetrator, then we can also start the investigation. And we can also, under our authority, compel information and compel to meet with the person or other people. And that's really important for us to understand the full extent and to really complete the investigation. But a really, as I said, a commonality across all our areas of work is being committed to ensuring that the will and preference of the person's upheld, and also about working with their safety, their rights, and front of mind is the dignity of the adult and balancing that with protective action as well. So overwhelmingly, what we see at the ADC is domestic and family violence. And that can present differently for older people and adults with disabilities. So it's really important to be alert to that to make sure that we don't miss that. And a big cause of that can be unconscious biases like ageism and ableism. So it's quite common for older people and adults with disability to be controlled and have surveillance. It's very normalised. So, for instance, having the doorbell camera or a tracker, or those kind of having their banking apps cared for by somebody else. But that can often happen under the guise of care and protection, and actually it can be used to prevent the person from having any safe or private space to speak about what's happening to them. So as an example, someone that we worked with was a woman, and she was also a stroke survivor, and she reported to experience physical and verbal abuse from her husband, and he controlled all her personal care. And we were told that she declined to have female support workers to assist her with her personal care, but no one had asked her why. No one had talked to her separately. And with our authority, we were able to meet with her alone in a safe space. And she told us that she declined the offer of female support workers because she was terrified of her husband's reactions and that, what he may do to her if that happened. So in cases, we manage the symptoms of abuse, but they're often attributed to the person's disability or age, or being a feature of that person's disability. And Angie did touch on this as well. For instance, another matter where an older woman said that when her son was angry with her, he would grab her forcefully around the neck. However, each time that she contacted the police, they accepted her son's version of the events, that he was just trying to do the best he could in providing care for her. So it's really important, and I guess I am repeating it, to make sure that we are putting the person first, that we're not relying on others to speak for the person, and we are hearing their voice as well. And it's also, as I said, to be mindful of ageist and ableist attitudes and victim blaming. So, as an example, where someone's behaviour or disability or mental health presentations use an excuse or explanation as to why the abuse is happening, that somehow the victim is to blame because they're labelled too difficult or it's really challenging. But sometimes what we find, or quite commonly we find, that's actually about unmet support needs for the person. I know that I'm at time, so I just quickly won't go through coercive control because Angie has covered a lot of that. But I did quickly want to talk about these resources that the ADC has that might help you in your various roles. And it's a suite of resources. They are about improving prevention and response to abuse of older women and women with disability. And in there, we have 4 free online modules, and we have a reflective practice resource and a safety planning tool. And the tools really try and aim to help the user take the perspective of how to work with an older person or someone with a disability, and really their prompts. It's not an all-inclusive checklist, but these checklists are things that you can use and you can add to yourself. You can see here they are interactive. You can tick the box. You can put your own notes in, and they go through different topics like financial, adult children, decision making, different forms of access. What if the person has younger children as well? Those kind of things. So I'm happy to send all these things out afterwards. We also have this reflective practice tool, which would be really useful for you to use on your own or in a peer group or supervision session. And they cover 6 different narratives of all different scenarios. And they're asking the user, if you were faced with this situation in your role, what would you do? And these were put together through expertise of our advisory group, but also people with lived experience. We're very grateful for their input to this as well. There is a version with answers, so you can see, what would the experts do in these situations too. And we also have these fact sheets that go with this suite of information, all available on our website and all free. I think I have come to time here.
Thanks, Anna.
Going to
Lots
stop
of
sharing.
ground covered, and the questions are coming in. So if you haven't asked a question, would like to, you can either ask it in the Q&A at the bottom. You should find the Q&A. Otherwise, you can also ask me directly if you don't want to advertise your name. But you can also, if you've logged in as an anonymous person, you can also post your question as an anonymous person. So that then takes us to our third speaker, Maria Casaniti. Maria is the Centre Manager at the Transcultural Mental Health Centre. Maria has a long career in the mental health sector. I remember working with Maria back in the 1990s. That's showing our age, but anyway. Sector working in clinical service delivery, strategic planning, policy, service, and workforce development and research. She leads the Transcultural Mental Health Centre, championing inclusive, equitable, and culturally responsive and safe mental health systems. Welcome, Maria. Over to you. And we're just going to take a minute to put those slides up. Well done. Looks good. Thanks, Maria. Just put your camera on as well. Yep, and off mute. Good to go.
Hi, everyone. Before I commence the presentation, I also acknowledge that I'm on Darug land today and pay my respect to elders past and present. And yes, it is a beautiful sunny day in Sydney, a good autumn day, I say. I also want to acknowledge participants in the audience with lived and living experience of mental health distress and trauma, and note that it is crucial that they are front and centre of all we do to address the impacts of mental illness, distress and trauma in whatever form it comes. Now, the Transcultural Mental Health Centre, for those of you who may be unfamiliar with us, is a New South Wales statewide service located within the Western Sydney Local Health District. We work in partnership with health professionals and a range of organisations to protect and enhance the mental health and wellbeing of culturally and linguistically diverse communities across the lifespan. Our service enhances access and equity for our culturally and linguistically diverse community through leadership in service development, planning and evaluation and research, cross-cultural training, education, supervision, transcultural mental health promotion, prevention and early intervention, and we have specialist clinical services and a range of multilingual resources to support the delivery of culturally responsive and safe services and programs. For today's presentation, I have been invited to focus on coercive control and cultural perspectives, and so add information based on what you've already heard from Angie and Anna, but with a focus on our culturally and linguistically diverse communities. If we can move the PowerPoint slide. Sorry. Can I just have that slide move? Thank you. Coercive control is a deeply insidious, non-physical form of domestic abuse that involves a pattern of behaviours such as isolation, intimidation, surveillance, financial restriction, and of course, for culturally and linguistically diverse communities, it also involves forcing a person to adhere to religious or cultural practices against their will, or preventing them from practicing their faith. It is a pervasive global phenomenon, recognised as a major health and human rights issue by the World Health Organization and the UN. It is deeply rooted in gender inequality, power imbalances. The predominant victims, as already explained, are women and girls, and it disproportionately affects people in socioeconomically and vulnerable contexts. While intimate partner violence and domestic violence are often recognised by physical acts, coercive control is a broader, often invisible pattern of behaviour that can be misunderstood or normalised within certain cultural contexts. And in some parts of the world, what constitutes abuse from a particular cultural framework may be perceived differently from another cultural framework. In many cultures, behaviours that countries like ours classify as coercive control are thought of as discipline, guiding or love, and not something that requires reporting to authorities. So therefore, within Australia, how do we strengthen our understanding of coercive control, support culturally safe and a rights-based response, and address its impact on mental health across our multicultural landscape made up of a multitude of cultural values and beliefs? So that's the million-dollar question for today. Now, if we can move the slide. Sorry, I think I've done something to my screen, so thank you. Firstly, we need to appreciate that the core aim of coercive control is universally shared. So I won't go into all the items listed on the screen. They've already been referred to, but coercive control is universally shared, and what is shared is the creation of fear and dependency and control. Thank you. Okay. Well, the screen's up. Just the next PowerPoint, please, because my screens aren't moving at this point. Thank you. So while the pattern of control...
Sorry, Maria, I'm just, we're stuck on pervasive global issue so on our screen.
Thank you. If we can move to coercive and cultural context, that'd be great.
I'll tell you when
I
it
might
moves.
just take some time. Yes, I just can't. Oh, hang on. If we just hang up on there, wait a minute.
Yeah, of course.
Thank you.
Okay, we're on patterns across cultures now. And coercive control and cultural context now.
Sorry about that. While the pattern of control is a constant across cultures, there are differences in definition, perception, and expression, and tolerance. And so this is what needs to be understood. While the core aim is creating fear and dependencies, the specific tactics used are often tailored to the victim and the cultural context. So coercive control manifests differently depending on cultural, religious, and social environments. Its prevalence and the effects of it are strongly influenced by a complex range of culture-specific beliefs, customs, social norms, and family structures, religion and legal systems, and in particular, cultural norms that tend to support male dominance over female partners. We also understand that cultural norms about coercive control often interact with lower socioeconomic status and limited education, making some women more vulnerable to abuse. So variations and the manifestation of coercive control across cultures exists through cultural and patriarchal norms, and the normalisation of male dominance and control, and causing women to view or expected to view behaviours such as financial control, verbal taunts, and belittling as normal rather than abuse. Family reputation and maintaining harmony can prevent victims from seeking help. Reporting abuse might be seen as disloyal to the family or even to the wider community. And women may be expected to submit to husbands and fathers, stay in violent and or coercive relationships, and avoid bringing shame to themselves and the family. So that is what we're battling in the transcultural space at times. In some contexts, control is also maintained through the threat of honour-based violence, and coercive control is often overlooked, and people impacted may not recognise it as a form of abuse. And so that's something that we've got to take on board as well, particularly when it is framed as a cultural or religious obligation, such as forced marriage. Economic abuse is common, and the way it looks across cultures varies. Shared finances can be manipulated, or conversely, the complete restriction of access to money can be used to create dependency. In some communities, financial control may take the form of demands around dowry payments, and women in Australia who experience dowry abuse may face barriers to recognising the abuse. They also experience language and cultural barriers, lack of awareness of their rights, or that there are services available to help them. And seeking help is often associated with feelings of shame, fear of retribution, cultural and social isolation.
Maria, I'm sorry to interrupt you again. We're stuck on the coercive control and cultural context slide. I think you've moved on.
I have. So can someone from your end move it to...
Oh, we'll need to cancel you presenting it and then one of the team present it. We can do that.
That'd be better. I think that would be better. I'll just say to move slides. Thank you.
Okay, Vanessa, I'm going to... So if you can stop sharing, Maria, we'll take control and share it for you.
Thank you. Sorry about that.
That's okay. It happens. And Vanessa, if you are okay to... Perfect.
Okay.
And so just let us know, Maria, what slide you were up to.
So if we can move to coercive control, and so we've moved through variations. So go to variations across cultures.
Keep going. Are we on track here? Have we ever gone too far, Maria?
No.
So we've got the resources page. Yeah.
Go right back.
Go back, Vanessa.
Yeah. Okay. Thank you. Yeah, stay. No, next. 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 Thank you. So coercive control, so when we look at the challenges for women experiencing coercive control in multicultural Australia, it is often exacerbated upon migration, especially for women who have experienced domestic and family violence and or coercive control in their countries of origin. Also, for others, coercive control can commence following arrival to Australia. So while cultural and linguistic diversity is not an explicit indicator of disadvantage or risk for coercive control, there are certainly unique challenges faced by migrant and refugee communities, including increased exposure to risk factors and heightened barriers to seeking support. And contributing factors include the move to the new country, which can involve experiences of trauma and prolonged hardship. The acculturation process often places additional stress on families and individuals, along with role changes within the family that can fuel coercive control. Victims from conflict zones particularly may be dealing with trauma of displacement, which perpetrators can exploit, making them more emotionally fragile and vulnerable to manipulation. Coercive control is not recognised as abuse, particularly for newly arrived communities. And this is something that needs to be really considered in how we address it in our services. And especially when it doesn't involve physical violence, that's where it is critically not understood. It is a new concept for many communities that come to Australia. So in their new context, women may continue to endure abuse to maintain family harmony. The cultural stigma and shame associated with divorce and separation traps them. And women and girls may experience a lack of community support and may be isolated from family and friends or close-knit communities while offering support. And they may also be manipulated by perpetrators to isolate victims. So also those that try to assist are manipulated. We also have to understand that a political climate that frames immigrants as others can increase isolation and fear and reduce the likelihood of victims seeking help due to a fear of racist assumptions and discrimination. Now, the other important point as people acculturate is when change can happen. So the previously accepted notions of partner behaviour may begin to be challenged. They may no longer be willing to tolerate patriarchal traditions, potentially causing more attempts at control by their partners. Therefore, the transition to increased awareness is associated with escalating tensions, and this is another thing that services need to be mindful of. If men see this change in attitude as a challenge to their masculinity, they may react with violence, potentially perpetuating the issue further. Therefore, this transition is a particularly high-risk juncture, and key strategies and specialist training are required for community agencies, service providers on how to carefully support women at this time. Another challenge for women is misidentification, and this has already been discussed. And for women from culturally and linguistically diverse communities, they are, often misidentified as the primary aggressor by authorities. And so training around this across the sector is required so that they are not misidentified. If we can move to the next slide, please. So the unique challenges for temporary partner visa holders are unique as well. The immigration status of women may determine how much she can trust formal systems such as police and whether she is eligible for services. And temporary visa holders are often unable to access social support such as income support, healthcare, or other relevant support services. And this further complicates the picture if they want to remove themselves from the environment that they are in. The fear of deportation is real, and individuals and families on temporary visas may face their own specific experiences of coercive control. And in some situations, abusers use their partners or family members' insecure immigration status to threaten visa cancellation and deportation. They provide misinformation and their rights to control or coerce them. So, for example, they may be told they face deportation if they will leave, if they are going to leave the relationship, or they may be threatened by the perpetrator who has citizenship that they will take custody of their children. So women may be very dependent and feel very dependent on a violent partner for residency, and therefore may not disclose coercive control. And isolation may be further heightened for those who do not speak English or drive, and so forth. Conditions of the temporary visas can also restrict women from accessing employment and housing, which is another cycle that they find themselves as well. And as for international students who experience coercive control, the intersection of immigration status for them and legal frameworks makes it also difficult for them to access support. Now, if we can move on to coercive control and children and second generation. So the consequences are, thank you, the consequences are not only immediate, affecting health and social needs, but are also long-lasting and intergenerational, adversely extending to the health and well-being of children. Children in these households experience severe long-term trauma, witnessing fear-based dynamics, and this happens across the board, not only for culturally and linguistically diverse communities. And children may develop anxiety, depression, post-traumatic stress symptoms due to the chronic exposure to fear and the unpredictable environments that they live in. Children may be threatened with separation from their parents or deportation as well. And in colder communities, children may be restricted from learning English or participating in social activities, deepening their isolation as well. So the intergenerational transmission of coercive control takes place across cultures, and these early experiences normalise abuse, teaching children that such behaviours are acceptable for conflict resolution, which increases the likelihood, as we know, that they will become perpetrators or victims of similar abuse as adults. Now, if we can move to the next slide. Now, continuing on the subject of intergenerational differences and perspectives with a focus on our culturally and linguistically diverse populations, if we look at first generation immigrants, we know that they are often socialised in different political environments, and they may have a higher tolerance for certain forms of control, or conversely, they are less trusting of local authorities to intervene. They may face intense pressure to adhere to traditional gender roles from their country of origin. There are also groups of first-generation migrants that move to this country to actually get away from these forms of control. So we have to be mindful that that also is something that we can leverage on and work with those leaders. Often they become leaders in community, and when they don't, they become trusted voices in their own communities. So we can't pigeonhole that first generations are, generally adhere to forms of control when that has been what they have been used to in their country of origin. So we've got to be mindful of the diversity that exists. Now, second generation immigrants tend to be more aligned with norms, values of Australian society, while also aligned to their family's culture of origin. They may recognise a coercive control in line with the definition understanding that we have here within Australia, and therefore they may experience conflict with their parents who may hold more traditional views, and again, they might not. But the assumption generally is with our second generation communities is that there will be increased understandings about a topic. So in this case, there will be increased understandings about coercive control by second generation communities, a dynamic where cultural views held by the family often reverses for second generation communities who live in a different context and political environment than their parents. We know generational asymmetry in perceived legitimacy occurs across all cultures. And in second generation, this basically means whereby they have different viewpoints than the first generation. And this is a critical point at where we can advance prevention, early intervention, response, and recovery and healing. By no means is it the only point. Another scenario is where a young person may disconnect with family's culture of origin, even rejected. Now, this position is at times understandable, but where possible and where safe to do so, it is best to work early to prevent young people rejecting their culture altogether, but rather use their different viewpoint to drive change within the family. And another scenario is intergenerational transmission, where members of the second generation continue to adhere to cultural practices from their family's country of origin culture. Therefore, they may not be in conflict with the parents' view regarding coercive control, and herein lies our challenge. So importantly, people have their own unique transcultural journeys, how they transition over time from one context to another, and how they hold on to culture of origin and how they embrace new cultures. Now, if we can move on to the next slide, and this takes me to the point that there are intersectional complexities of coercive control, and it is a deeply contextual form of abuse, coercive control, and its severity and impact are magnified by intersecting inequalities. And there are systemic barriers around this as well. And we know that services and legal systems often do not recognise, or we are not well equipped to handle the intersectional realities of the abuse. And if we can move to the next slide. So if we look at now mental health and wellbeing, we know that coercive control is linked with long-term mental health consequences, including post-traumatic stress disorder and complex post-traumatic stress disorder as well. The complexity arises from the intersecting inequalities and the impact of many traumas. We know there's depression, anxiety, alcohol and substance use disorder, as well as suicidality. So for culturally and linguistically diverse communities, diagnosis of mental health may be further complicated when it coincides with coercive control, and particularly when the abuser presents as the carer of the person who they are abusing, as Angie earlier explained. There are also physical consequences with coercive control, chronic pain, fatigues, gastrointestinal disorders, and so forth. So managing coercive control in mental health settings in particular requires a combination of trauma-informed practice, cultural sensitivity training, and shared information on local laws, and the use of intersectional client-centred approaches. Trauma-informed care and culturally safe interventions are required to support long-term recovery, which also recognises the impact of migration, trauma, and systemic vulnerability. Empowerment counselling approaches will support individuals to gain confidence in their decision-making as well. And using a transcultural mental health lens further enables us to better understand the intersections of transcultural mental health alongside the coercive control experiences by addressing the specific cultural context of both the workforce and clients and mental health providers. And so they can better detect and intervene in such situations. If we can move to the next slide, please.
2 more minutes, Maria.
Yep, thank you. Nearly done. I won't go into the barriers of support because I think we've touched on most on the barriers. We haven't touched on underreporting. Of course, the barriers lead to underreporting, so we don't understand enough about this group of people. And furthermore, it is essential that the coercive control laws in New South Wales are applied in a way that does not disproportionately impact the vulnerable and particularly communities and women that come from cold communities. Now, if we can go to the addressing disparities in cold communities, and this is one of the, I'm rounding up now. So we know that there are principles that the national government has put out, and I won't go into those principles, but it's good for everyone to have a look at those principles. Now, and what the principles look like for cold community are that we need to increase awareness about coercive control and with different groups, so with new and arriving communities, with first and second generation communities, in a way that is meaningful to their transcultural experience. And it's essential that services partner with trusted community leaders. And we know this has made a difference in many campaigns that we've done in other aspects of public health. We need to also enhance our understanding of the particularities of women's lived experience, deeper understanding of cultural constructions of marital institutions among communities as well. And of course, there's cultural and safety and responsiveness training, which is required. And this is important to distinguish cultural norms and abusive behaviours. Training should explore how cultural pressures, shame and stigma and fear of community will help prevent help seeking. And last but not least, we really need to leverage the knowledge and skills of our bicultural workers as well, and skill our interpreter workforce to work well in coercive control as well as domestic violence. Now, if we can move through the other slides quickly as we round up. Thank you, Nick. Yeah, so basically, I think these have been touched on. What we need to look out for is things that Angie's already touched on. The resources, you'll have all this in the slide package that gets sent out to you, and the services that you can contact as well. Thank you very much.
Thank you, Maria. Lots of information there. And as you said, those slides and the recording will be available. Stay on video with me and I can ask Angie and Anna to join as well. We're going to do a speed dance through a lot of these questions that have come through. And I think, Vanessa, if you could just spotlight Anna and Angie as well, that'd be great. So let me start off with the first question to you, Angie. How characteristic is it for people to interpret coercive control as love and protectiveness, particularly as it relates to between a couple and between a parent and child? And I know someone wrote in the comment, you know, Life 360, for instance, we're all tracking where we all are. And, you know, where do you draw the line between support and protection versus coercive control, and how do you differentiate between the two?
Yeah, it's a great question and a bit tricky, because ultimately when we're talking about mobile devices and tracking, essentially, it's become so incredibly normalized. So even with our children, I mean, I'm a bit older now, so my children are all adults. And so, you know, I was able to raise them in a way that tracking wasn't actually a thing. But now we're giving our young people, like children, devices, and the entire purpose of that device is so we can track them for safety. So what it really comes down to, I think, because it is so normalized, is the intent. So, you know, effectively, and for young people with devices, again, it's so normalized, and most of the apps will have those location capabilities and tracking capabilities. So it's really about trying to unpack that intent. So why is somebody needing to or wanting to track the other person? So if we're talking about young people in the context of coercive control, and from young person to young person, it's really about the purpose of that tracking. If it's from parent to child, again, it's really about that tracking. For parent to child, we would like to think that it's about safety. For young person to young person, we would like to think it's about safety. But in reality, we need to unpack what the purpose of that tracking is about. And if there is a sense, if you're working with somebody and there is a sense that the tracking is for exactly that, to be able to find out exactly where they are at all times, without that real safety lens, it's really then about addressing that potentially with a specialist DFE service. So being able to talk to them about what that particular situation is looking like and what kind of supports we might be able to put in place. Quite often young people won't understand or won't know, well, not even young people, but most people in that victim survivor space they can't understand that is a form of abuse until quite often it gets too far into it. So quite often at the beginning, there'll be lots of love bombing, for example. So, you know, let's track each other so we can make sure that each other are safe. Let's track each other, you know, for all of those sort of safety reasons. And before we know it, the victim survivor is entrapped in a situation that is incredibly difficult to escape. And adding on the intersections of mental health presentations, the episodic nature of mental health at times, it can actually be really disguised by the person who's using the violence.
Thank you, Angie. And I think if I can summarize that, you're talking about not necessarily tracking in an isolated incident that is clear in terms of its intent, but it's kind of the patterns and other things. Not to say that one thing in isolation isn't coercive control, but potentially when you add in a few other things, there's more clarity there. Anna, there's a few questions for you. I've noticed, this is Magda. I've noticed that a number of older clients, particularly those who are lonely or socially isolated, have been targeted by online scams. Would your service be able to assist them with strategies or support to help protect themselves from from this type of abuse? Not necessarily coercive control, but it's still a form of abuse.
We don't do that work of that scam prevention. There are other agencies that do that, but we do have a lot of reports where the person has been the subject or victim of a scam. So, for instance, someone posing as someone famous or a soldier or someone who's going to come and, take them away out of their situation. And we do get involved in those. If you have those cases, you can make that report to us. Really, it's about our approach of working with the person, developing trust with them, trying to give them information about how to safeguard themselves as well. And depending on the level of risk, working with banks, police, so on as well, getting them involved. We have a lot of MOUs with other agencies, so we are working parallel and alongside with them as well. So unfortunately, that is a common scenario that we are seeing.
Thanks. And then staying with you for a couple of other questions. There's a question here from Samantha. If you make a report, are you required to inform the person involved that you're actually doing this?
No, you're not required to. You can make the report and be confidential. Very commonly, we will contact the person and ask them what they want. But if we contact the person and you've asked to remain confidential, we won't disclose who you are or who made the report. We'll just let them know that that a report has been made about these concerns. And we are very much person-centered. So if that person says, "Oh, I don't want to do anything at this point," we very much respect that. But we will just say to them, well, here's our number if you ever need anything. Here are options that you can have available to you. If they're more higher risk circumstances, then we can commence an investigation, but we do have to have that evidence there of that higher risk.
Thanks, Anna. And one more for you. Is there sorry, Jennifer is on the border of New South Wales ACT, and is there a Victoria equivalent of the ADC? I work in the Victoria New South Wales border. I'm assuming the answer is yes there.
Not all states have an equivalent of us.
Okay.
Victoria have the public advocate, and also ACT have that. Sometimes it's about working with local police as well. But yeah, no, South Australia definitely have a safeguarding body very similar to New South Wales.
Okay, thank you. Maria, can you tell us a little bit? I mean, through your slides, you talked a lot about coercive control and the migrant experience. I guess the question, whether it's in your workforce or whether it's in the workforces we collectively work in, how do we support the workforce with multitude of cultural values and beliefs, some of which may represent coercive control in the white Australian context, but may be commonly accepted in more patriarchal societies? It's a really tough question. Someone from an Arabic speaking background, I'm really aware of where this question is heading. So what's normalized in one society isn't necessarily considered normal in another. How do you manage that?
Yeah, and certainly I think that's the points that I was making, that kind of big picture. But within our workforce or the broader workforces, when you have quite diverse people working in the workforce, they're also trained. So there's different ways of knowing and understanding. So they're trained. Our workforce is trained in mental health. They also come from a multitude of cultures. And I think supporting their well-being and where they're at, and it's those daily touch, points. Like our team, we meet on a daily basis, and the team, I might be there, I might not be, but we have our team leaders, and they meet on a daily basis. So all requests and referrals that come through are discussed in detail. And our team members are supported through that. But something that's really important is looking at the immigration timeline as well. Of course, communities that have been here a long time, and so the people working in those communities with their mental health training would know that the awareness has already increased. So they're going to be at a different stage of understanding coercive control and domestic violence versus communities that are newer into the country where, as I was saying, they might understand physical violence, it's clearer, but they don't understand coercive control. It doesn't make sense to them. It is a construct that has come in, and it's an important construct, obviously, but it's something that makes sense to us, but not necessarily to a lot of the newer communities that come here. So that's the work that we have to do. And so as we do our campaigns, and we need to know that of how we target those communities. And as for our workforce, obviously people that have come here and have started working in this space within the Australian context, we need to be aware that the newer communities or the members of the newer communities that are trained in working in mental health may need much more help because there'll be increased demand for their services as well. So it's going to look different, and I think it's about taking that transcultural lens. There's, and obviously taking that intersectional lens as well is absolutely important. But it's wellbeing. So the other thing we do is clinical supervision. We have our group, so everyone has the individual supervision. They have their team. The daily huddles and meetings, but they also have that independent clinical supervision, and that's really, really important. But as we move forward, and on the subject of coercive control, we really need to have the training that we do for mental health workforce in particular has to embed all these cultural aspects into it and the transcultural lens. They can't just sit on its own. It is part of the whole of how we move forward. So I think that's
absolutely. It's about increasing awareness, and you don't know what you don't know. I think when you're in the sector, you're more exposed to all this stuff. But when you are potentially a migrant, or if you're not even a migrant, if you're just, an Aussie who lives here and you haven't had this exposure to the language of bullying or coercive control or financial control, and you don't know what you don't know. So awareness is really, really important to start with. That's why we're doing these webinars, and that's why we continue to get the word out. This is a question from Rachel. Is exposure to coercive control in the home considered child abuse, like exposure to physical and sexual abuse? If we become aware of coercive control in the home when working with a child, is this considered a mandatory report situation? The quick answer to that, I think, would be yes. But Angie, did you have a view on that?
Yeah, I think, short answer is we always have to err on the side of caution. But I think it's really important. I mean, each situation looks different. We need to centre children as victim survivors of domestic and family violence. So if they're not only experiencing domestic and family violence, they're actually victim survivors in their own rights. So there's been a bit of movement around, really positioning and centering children in this, because they've actually been quite forgotten, since we sort of started putting language to this. So, I think each individual circumstance would look different. I would always err on the side of caution. And I'd also, if it's safe, bring mum into those discussions if mum is the victim survivor. And depending on what the relationship is that you have with mum, but if she's disclosing incidences or a pattern of abuse, you'd be leaning into that and you'd be talking to her and potentially working through that report with mum if it's safe to do so. It's quite a nuanced question in reality, because each situation will look quite different. But once you understand that there's coercive control that's taking place, you would be obliged to make that report.
Angie, I'm just going to stay with you. I remember when DV New South Wales first started working in this space many, many years ago, this question correlates to that. But if someone is experiencing coercive control and is under financial constraints, such as being locked into joint leasing agreements, we see that quite often, or, loans that are made out in that person, in the victim survivor's name, sometimes unbeknown to the victim survivor. But anyway, or unable to afford rent without the perpetrator, is there any supportive options to assist without reporting the control?
Without reporting the control? Yes, there are now. So there are products with homes. There's a Start Safely package, which is a New South Wales state government product that effectively assists with a subsidy for rent. But the problem, I mean, the reality is for everybody at the moment is that there aren't many rental properties in, available rental properties. So there are some options. I would always encourage, if you're working with a victim survivor, to contact the local Women's Domestic Violence Court Advocacy Service for some support in New South Wales. That's in New South Wales. And try and get some specialised information. They have really good contacts also with the different sort of government bodies that can provide some assistance in that space, and legal support also. So it would probably be a good idea. I would suggest to give that service a call, provide them with some information, anonymously about the client that you're working with, and get some ideas about which avenue to go down next. Quite often, it'll be a legal avenue, potentially, if it's around finances and around debt. There's some great services that can provide that support, and I'm happy to provide further information after this, also about some of those services that can provide that support specifically.
Thanks, Angie. 2 more questions, and then I think we're going to have to move on. How many people statistically have been charged or found guilty of coercive control in Australia, if known? Does anyone know the answer to that?
I know in New South Wales, we've had, I think we're up to about around the 20 odd charges since 2024. We've had 2 convictions. One conviction was a plea of guilty and a community corrections order, which is an order in the community, effectively a supervised good behaviour bond. And the second conviction was a 12-month custodial sentence for the perpetrator. So it's a really, legally, coercive control is an incredibly cognitive piece of legislation, but it's also in its terminology is also incredibly cognitive. Like Maria was saying, it manifests in many ways, but there are many pockets of the community where it can actually be weaponized, and it's actually not understood, and it's not deemed as as a form of abuse. So there is a lot of work to go in that space, and I know from an advocacy perspective, we've tried really hard to kind of move away from just how cognitive it is. Ultimately, it's the legal threshold for the charge to be successful is actually really quite high. So it's an interesting piece of legislation.
Yeah, absolutely. And Maria, I might come to
Sorry,
you.
can I just
Sorry,
add
go
to
on, Anne.
that? I just want to add that for New South Wales, as Angie, like earlier in her presentation, said, it's just the law is just about intimate partners, but what we're seeing, and I think all the speakers represented as well, is that it's happening in all different types of relationships, especially those caregiving or support roles. And so there's a lot of, I think, change that's needed and hopefully will occur when that law is reviewed to make sure that it's not just about intimate partners, but also those domestic relationships as well.
Thanks,
Absolutely.
Anna.
We advocated very strongly around that, because there are just so many people missed out in that legislation. What the feedback is at this point in time is that the New South Wales Police Force do not have the resourcing to be able to investigate all of the matters that would be coming forward. So at the moment, it takes on average, about 126 hours to investigate a coercive control matter. And so they're effectively saying that their resourcing isn't up to scratch, which we kind of always knew was going to be the issue. So we are, as a peak organisation, we're strongly advocating for the relationship scope to be broadened. So yeah, the statutory review commences from the 1st of July this year. So happy to keep you all informed about where we go from here.
Thanks, Angie. Maria, one last question for you. Can you tell us a little bit, this is from Corin, a little bit about coercive control in the workplace, what your organisation's experience is with reporting coercive control in the context of the workplace?
Oh, in the workplace? We haven't, well, the wider system would have had as in the wider New South Wales health system, may have had more experience with this. In our service particularly, we haven't had reports. I mean, our work with clients, we certainly do see forms of coercive control, which we have to be careful with assessing as well, as we know, because it's not just one incident or a couple of incidences. There has to be a pattern, and because our work is with clients is short term, we don't always see the whole picture. We might see part of the picture, but we might be an important where we come in with our mental health services. It may not have been picked up, but because of the cultural lens that we bring in, it will be picked up and explored further. So we've seen from our clients, particularly, we've seen, I mean, obviously domestic violence, but coercive control. In terms of the workforce, that hasn't come up, well, it hasn't come up for our service a lot, or at all, so I would know about it. Yeah.
No worries. I've got some questions here about services for specific priority populations. So I think we're going to take that on notice in the panel. If you have any information and resources about data available for LGBTIQA+ and the correlation of coercive control, and also from Julie for First Nations women and LGBTI and young people. It says young people specifically in the workplace. So we might take those on notice. We've got 3 minutes to the end of this webinar. So any final comments from the panelists before I wind this up? I think there's a question here about contact details for each of the panelists. So we'll provide that on in consultation with the panelists.
Yeah, happy to chat with anybody offline. And also, thank you all for the work that you do. It's hard, you know, and I think it's really important to acknowledge the incredible work that you're all doing. So thank you.
Thank you so much, Angie. Anna, any final comments from you?
Look, I'd just like to echo that. Look, in our teams, when they do investigations, particularly those involving coercive control, work really closely with service providers. We try and take a really practical approach, trying to do a lot of capability uplift, and that creativity as well of trying to find a way to safely meet with the person. And so we have a lot of reliance on service providers in that space who know the person well and know what's going on well. So thank you all very much too for your support.
Thank you. Maria, any final comments?
Yeah, I think, look, the take-home message is we need to really move forward with balancing cultural safety and care with a rights-based response. I think in contexts like Australia, we do this kind of work really well. And once that we take off and once we get our heads around it and training around it, it will look better down track. But I think that's the take-home message. We need to move forward with cultural safety and balancing that with a human rights approach. I also think we need to take absolute advantage and embrace our culturally diverse workforce. That's how we're going to understand this more. And I think understanding women, like we really need to understand the particularities of the lived experience. And I think we haven't done anywhere near enough of that. And then, you know, move that forward, our understanding into service provision, research and policy, as well as legal frameworks as well. So thank you.
Thank you, Maria. Thank you, everyone, for your participation and enriching this discussion with your questions and perspectives. Please join me in thanking our wonderful presenters, Angie, Anna, and Maria. Thank you for sharing your insights, and thank you to everyone who joined us today. I also take this opportunity to thank Corinne Henderson, our Director for Policy and Systems Reform, who curated today's webinar, and to Julia, Vanessa, and Evie for the support and the logistics for today's webinar.